Blood cancer is any kind of a cancer that arises of one of the blood cells or their precursor cells. There are three kinds of blood cells: the red blood cells, the white blood cells, and then the platelets. These cells mature over a series of steps from what are called precursor cells. Blood cancers can arise either from these mature cells, either one of these three lines, or from their precursor cells. Broadly speaking, blood cancers are categorized into acute leukemias, chronic leukemias, multiple myeloma kind of disorders, and lymphoma. A particular kind of cancer has its own kind of treatment. They have their own outcomes, they have their own behavior, and they have very specific treatment. And in this day and age, we're getting more and more specific as far as our treatments are concerned. Now we don't just have chemotherapies, we have a lot of other options. We have what are called targeted therapies. There are certain drugs that are designed to hit those targets and kill those kinds of cancers. Then we are in the age now also of what are called immunotherapies. That means we have medicines which can stimulate your own body immunity such that your immunity kills the blood cancer cells. Treating blood cancer is a specialty within a specialty effectively. So it is important to go to a place where there is proper expertise present and where there are proper facilities and resources available. Yet initially, they need to make a visit to a high volume center, that is a center that has a good reputation in treating blood cancers. And they can take their advice on how to carry forward treatment in their own local center from there on. Apart from certain super specialized medicines like that, virtually 95% of the medicines available to treat blood cancer in the world are also available in India. There are three major problems that happen in blood cancer patients in this country. Number one is, as we just discussed, access. So these are available only at very specialized centers, and access of the general public to these centers is limited, and repeated access becomes very, very difficult because they consume resources and so forth. Second issue is money. Many of these newer treatment modalities are expensive. The typical Indian middle class or the rural lower classes find it very, very difficult to afford these prices. So at some point in time, the issue of money is going to be a major hurdle in continuing with their treatments. Third issue is there is some excellent research that came out of CMC Vellore and other places that nutritional status seems to, especially in children, seems to affect the survival rates when we treat blood cancers. So for three good reasons, it seems that our cure rates here in this country do not match those of the West. Where all these three hurdles can be overcome, in other words, in those patients that we get where we can give them adequate treatment on time and we can complete treatment and we can address nutritional issues, then the outcomes and the cure rates are exactly the same as they are anywhere else in the world. Marvelous advances available. Please do not lose hope. The majority of blood cancers can be cured very well, or at the very least, they can be controlled for years and years and years. Although blood cancer is a dangerous disease, there's no point lying about it, there's no point dying it. Most blood cancers are deadly and can be deadly, but there is help available, they can be treated, they can be controlled very well. We have all the necessary expertise and the resources in this country. The one-line advice I'd give to blood cancer patients who have active blood cancer and who are also blood cancer survivors is, please take COVID very, very seriously. The reason for this is, now we know that there's a very good data that many people with blood cancer, even if they have had blood cancer in the past and they're cured, their death rates seem to be much higher from COVID than the average person. For example, the national death rate in India from COVID is only about 2%. Now we have that in perspective. But people with blood cancers, especially cancers such as acute leukemia and all that, even if they are cured, the death rate can be as high as 33%. That's a very, very high number.